here today. Thanks for those that are in person, and special welcome to those that are online. As you know, I'm Jenifer Waldrop, the Executive Director for RDDC. This is my second time hosting this event with Global Genes. I'm so excited to be able to sit here. I think back, if anybody attended last year, I was brand new into my role. I think I was in week number 1 or 2. And so just kind of being able to relax a little bit this year and interact with some of you all before I came onto the stage has really been exciting. And I'm excited to see how today plays out. If you don't know, RDDC is a coalition that started 3 years ago, and our mission is to actually close the health disparities, especially amongst rare disease communities. That is our big goal. And within the next couple of years, I'd really like for us to shorten the diagnosis timeline for those that are impacted by rare diseases. So for RDDC, health equity is a must. And obviously our huge focus is around rare diseases. So just wanted to share a little bit about what I learned last year as I've come into this role and some of the feedback I received from those that attended. Charlene and I have some things that we want to share with you about today's agenda. Charlene, what are you thinking about? This is your first time being here, and so welcome. And so we're really excited to have you a part of this amazing experience.
Yeah, I'm really excited to be here. This is our 3rd annual Rare Health Equity Forum, and we're hosting it in sunny, or trying to be sunny, San Diego. We're hoping that the sun peaks out in partnership with Jenifer and RDDC. And I'm really excited that we're going to be able to explore this intersection of rare disease and health equity. And one of the things that and this is my first. This is my first Health Equity Forum, so I'm excited to really be here and learn this year. But one of the things that I am particularly excited about is that the focus is on not just discussing these really significant systemic issues that we face in this intersection of rare disease and health equity, but also really talking about concrete plans and action steps that people can take away from this event. So, and Jenifer, I'm curious, what topics are you excited about over the next couple days?
Yeah, thanks for asking. When I look back at last year's event and then looking forward into this year's event, Rachel and I were talking about what should we be talking about at a place like this? What might be really interesting for folks? What have RDDC and what has Global Genes been doing this past year? And let's share it with you all. One of the big areas we're excited to talk about is actually happening tomorrow around clinical trials and research. And as many of you may know, rare diseases historically hasn't actually had a lot of clinical trials. And so it's been a part of, I think, the journey, essentially. And tomorrow's conversation, when you think about it through the lens of historically underrepresented populations, we have some great folks out there. I'm a big advocate in having others be advocates. So if you have some great experience, why not tell others about your experiences? Don't keep that secret experience to yourself. We live in a society. And so tomorrow, I can't wait to hear from those that have had the experience with clinical trials and to share their experiences that can help really advocate for the area because they themselves have walked in that experience during that time period. So I'm excited for tomorrow's discussion around clinical trials. Yeah, Charlene, I'm curious with the next day or so, obviously the obvious part of this, and it's your first time doing this, is even the weight of the program is much lighter this year than it has been in the past, and that was by design. So what else should we expect that might be a little bit different over the next day or so?
Yeah, well, I think that a couple of things are the interactive sessions. So we're having table talks tomorrow, which I hope that you all are excited about participating. And this will give people a real opportunity to have that interactive discussion and exchange ideas in real time that I think is really critical for this type of exchange, and again, for us to get back to how do we take actionable steps outside of this forum once we've all left. So that's one thing that I'm really excited about. The other thing that I'm excited about, of course, in addition to the networking reception that is happening later tonight, is that we're going to be doing a showing of selected films in the Rarely Told Stories segment, and that's at 5:30 today. And so for those who aren't aware, Global Gene's Rarely Told Stories program educates rare disease patients and advocates on how to tell their story and create films. And so we'll have an opportunity to see a selected number of films this evening at 5:30.
Yeah. So we have lots going on. I hope you all have brought your energy with you. I hope that, as somebody says, I brought in my conference hat on. There's quite a bunch of people here that I think you've made friends in the past here. So hopefully this is a chance for you to reconnect.